Good evening, everyone. Thanks for tuning in with us for our weekly stats report. My name is Sara, epidemiologist at the Jefferson County Health Department, and tonight we are reviewing the week 38 COVID-19 data. The CDC week 38 began on September 13th and ended on September 19th. So our data will include everything reported up until that Saturday, 9/19 end date. We release a few different reports each week, all of which are available on our website. And today we will start off, as always, with a detailed review of the weekly COVID-19 surveillance report for the entire county. Later on in the video, I am also going to highlight some of those main pieces from the other reports, including the hospital systems report, the 0 to 19 age group report, and the report that excludes the long-term care facilities. We will begin with our weekly total COVID-19 surveillance report, including our community-based cases, as well as those long-term care facility cases. During week 38, we had a total of 503 confirmed and probable COVID-19 cases in Jefferson County. 468 were lab-confirmed cases, and 38 were probables. But those probable cases are very important in our count, and I'll explain why in just a moment. Our year-to-date total is 3,992 cases as of September 19th. We are reporting 60 COVID-19 associated deaths, as well as 19 outbreaks in the long-term care facilities. Outbreaks in those long-term care facilities are defined as one or more confirmed cases of COVID-19 in the residents or the staff. Starting with Table 1, we are looking at the number of confirmed and probable cases by week. We're going to skip down to the bottom of the table where you can see those numbers from week 38, which began on 9/13/2020. The date listed represents the start of our week, so the data reported includes everything from Sunday the 13th to this past Saturday the 19th. Our weekly case count has increased, as many of you may be aware, and not only has it increased, but it went up quite a bit. We had over 500 cases this past week, which means we are averaging about 71 cases per day. This table does include our lab-confirmed and probable cases. The lab-confirmed cases include those individuals who receive a positive result from a diagnostic test. And those probable cases are very important to include in our count because they are individuals who have met two very specific criteria. One, they were a direct contact of a positive case, and two, they have become symptomatic since having been in contact with that positive case. The likelihood that the probable case has COVID-19 is very high. They have been a direct link to a positive case and are actively ill, but they just may be waiting on a test result or have not yet been tested, which is why they have that probable status. In Figure 1, we see the confirmed and probable cases by week in bar graph form, which helps to show how our weekly case count is moving. We are always going to see fluctuations from day to day or week to week, and that's why it's important to look at the overall view and not focus too much on those specific numbers. It is concerning that we had such an increase in cases this past week, though, and we can't stress enough that in order to slow this down, it has to be a community effort. Communicable person-to-person diseases like COVID-19 can't spread if those infectious respiratory droplets aren't making its way to a susceptible person. It really is up to each one of us to do our part when it comes to this virus. We can slow down these numbers, so please help us by practicing those mitigation strategies and cooperating with the health department if you receive a call. It's also important to be proactive and quarantine or isolate yourself if you start to have symptoms and you've gotten a test, even if you haven't heard from us yet. The next chart shows a breakdown of the daily case numbers and the 7-day rolling average of cases. The dotted line is the number of daily new cases, which you can see it does fluctuate from day to day. That solid blue line, which is the 7-day average, helps to smooth out those fluctuations in the data. We had a couple really high case count days this past week where over 100 cases were reported, as well as some low case count days. So that's why a rolling average is more reliable than if you were to strictly just go based off of those daily numbers. This 7-day rolling average of cases is one of the main indicators used for that color guidance chart for our county. Based on our numbers for this past week, we have moved up into that red status. Next, let's look at the overall age group data in figure 4. The 20 to 29 year age group still has the highest number of cases with 677. The 80 plus age group still has the highest rate per 10,000. Our highest increase actually came from the 10 to 19 year age group, who experienced a 24% increase in overall cases. In figure 5, we will be looking at the fatalities and the fatality rate by age group. There are now 60 reported deaths in our county, most of which have been in our 80 plus age group. 17 of these deaths have been in the general community, and the rest were members of the long-term care facility community. Our cumulative fatality rate of 1.50% in Jefferson County is still slightly lower than Missouri, where the fatality rate is 1.58%, and it is also lower than the United States, where the fatality rate is 2.93%. Moving on to figure 7, we have the COVID-19 PCR test results by week, as well as a nice visual of that percent positive rate. This data only includes those lab confirmed cases, so the number will look different from our main weekly case count because it does not include those probables. The dark blue dashed line is our percent positive, and right now it is around the 15% mark. Let's break these numbers down in table 3, where we can see the actual values of those positive and negative test numbers. In week 38, we had 468 lab confirmed positive cases. When we are counting those positive tests, we never include duplicates in this total. We do have staff who follow some very strict processes to make sure that even if duplicate lab reports do get sent to us, that none of these are ever counted twice in our overall count. This count also doesn't include any of those probable cases. Our percent positive for week 38 is currently 15.6%. As many of you know, this percent positive tends to stabilize after a couple weeks because we do continue to get those negative reports well after this report is published. We rely on the state to process and report those negative test numbers to us, and there's often a 3 to 4 day reporting delay. It's not uncommon to see that percent positive change from the previous week or two until all of the lab reports have come through to us. I always keep these numbers as updated as possible, so those small fluctuations in the data should definitely be expected as more reports come in. For example, last week our percent positive was around 11%, and now it has adjusted to 10% because of additional reports that we've received. Moving on to table 4, the COVID-19 cases are divided up by race and rate per 10,000 residents. The white population in the community has the highest number of cases with 2,963, as well as the highest rate per 10,000. As a reminder, we do not include any missing or unknown race data when calculating these rates. For the zip code data this week, we can see the cumulative number of cases in each area shown in blue, as well as the active cases in each area shown in orange. The active cases are those new and recent cases that are currently under investigation and in the process of completing their isolation period. Our Arnold area 63010 still has the highest number of cumulative cases as well as active cases in the community. They currently have 203 active cases and a cumulative total of 675 cases overall. But a few other areas do have a high number of active cases at the moment. Those areas are 63020 DeSoto with 144 active cases, 63028 Festus with 125 active cases, and 63052 Imperial with 116 active cases. As we look at the cases by zip code per 10,000 residents, things do look a little more even across all areas in this graph. The rate per 10,000 takes the population of each individual zip code into account. This helps to give a fairer comparison among some of those areas that may have a higher population or smaller populations. And as you can tell, many of our areas do have a very similar rate per 10,000, even though their populations vary. Currently, the Herculaneum area, 63048, has the highest rate per 10,000, followed by the Festus area, 63028, and Crystal City, 63019. For our hospitalization data this week, we are once again going to take a look at the data we receive directly from those local hospital systems. We are still currently receiving information only from BJC and Mercy facilities, and as always, we are actively working on receiving that data from SSM. So this does mean that the hospital systems report that you find on our website, as well as the data that I'm about to present, is not complete. There are hospitalizations at those SSM facilities that we are aware of, possibly through our resident reported data, that are not included on this report because we didn't get that information directly from the facility. This also means that there could be deaths that we are aware of that have occurred in the hospital but are not on this report as well. So what is presented to you in this hospital report is meant to give you a snapshot of what's occurring in our community and in our hospitals, but it certainly should not be used in any context that would imply that these are the only hospitalizations and deaths that are happening in our community. As of week 38, a total of 291 COVID-19 associated hospitalizations have been reported from the hospital systems for Jefferson County. 38 of these patients have been admitted to the ICU, and 14 positive COVID-19 cases required ventilators. In figure 2, we have the hospitalizations divided by age group. The hospitalizations that are counted are going to include everything from an emergency room visit to those who are admitted as an inpatient. Each one of our age groups has experienced at least 1 or 2 hospitalizations. The highest number is still within our 70 to 79-year-olds with 60 hospitalizations. But as you can see, no one is necessarily exempt from experiencing these severe symptoms or the severe effects that come from this virus. So it's important to take precautions and really focus on those prevention methods as a way to keep yourself healthy and to keep your loved ones healthy. Next, we will take a look at the length of hospital stay. We have had a cumulative total of 115 emergency room visits. There are currently 22 Jefferson County residents who are still in the hospital at either BJC or Mercy facilities and are COVID-19 positive. Most of our hospitalized residents remain in the hospital for 1 to 2 days, but there's also a good amount of residents who have been staying longer than that as well. Next, I want to quickly touch upon the current school-aged population data. As of week 38, there have been 552 total lab confirmed and probable cases in the 0 to 19-year age group for Jefferson County. In figure 1, we see the number of confirmed and probable COVID-19 cases by week for the 0 to 19-year age group. And during week 38, there were 101 cases reported for the 0 to 19-year-olds, which was quite the increase from weeks past. In figure 8, I have created an overlay of all 4 of the age-based grade levels and their 7-day rolling average of daily cases. I like this graph because it shows the comparison among all 4 age groups. As you can see, the pre-K, the elementary school, and the middle school age groups all kind of teeter around having anywhere from 1 to 2 cases per day, on average, but it's that yellow line, which is our high schoolers, who are continually seeing an increase in the number of daily cases on average. Lastly, we will quickly review the weekly community-based surveillance report, which excludes those long-term care facility cases. In Figure 1, we will see the weekly case count, excluding the long-term care facility cases, and during week 38, 483 were community-based cases. This means that that spread is really coming from our general community at this point because only 20 cases were found in the long-term care facilities last week. Those cases come from both the residents and the staff of those facilities. When we look at the age group data for our community-based cases, once again, it's that 20 to 29-year-old age group that has the most cases with 637. And they also have the highest rate per 10,000, which you can see there below that case count. And lastly, for our zip code data, excluding the long-term care facilities, 3 areas still stand out when we divide up our community-based cases by zip code. Those areas are Arnold 63010 with 518 cases, Festus 63028 with 453 cases, and Imperial 63052 with 508 cases. Please be sure to refer back to our website to get more details and recommendations on our COVID-19 homepage. And be sure to leave us any questions that you may have in the comments or reach out to us via direct message. Have a safe and healthy rest of the week. And thanks again for spending some time reviewing the stats here with us. Have a great night, everyone.